So your doctor told you that you have IBS. What is that? Is it a real diagnosis, or is your doctor just giving up and saying they don't know what's wrong with you? Are they trying to tell you your symptoms are all in your head? Well, I'm a board-certified GI doctor, and I treat patients with IBS every single day in the office. So let me explain it to you. In this video, we'll define IBS and explain exactly how I diagnose it as a GI doctor. Then I'll explain what IBS actually is. It's way more complicated than you might realize. And lastly, I'll discuss the many ways we can treat and manage IBS, from diet to medications. First of all, what does IBS stand for? Irritable bowel syndrome. It used to be considered a diagnosis of exclusion. This means that other diseases like Crohn's disease, celiac disease, or even colon cancer needed to be ruled out as possibilities before diagnosing someone with IBS, meaning that you needed a colonoscopy, blood tests, stool tests, and maybe even abdominal scans before being diagnosed with IBS. Now, we're moving away from this pattern to an extent. IBS isn't simply a blanket diagnosis for GI symptoms we can't figure out. It has a specific definition in the Rome 4 diagnostic criteria. IBS is defined by chronic abdominal pain at least 1 day per week for at least 3 months that's associated with a change in bowel habits. Now, what is a change in bowel habits? That's diarrhea or constipation or both, and your bowel movements should be associated with your abdominal pain in some way. Meaning, for example, you typically get pain when you need to have a bowel movement, and or your pain improves or at least temporarily improves after you have a bowel movement. Now, what's frustrating for patients is that there's no specific test for IBS. You can't see it on a colonoscopy, there's no specific blood or stool test for it. So naturally, this makes diagnosing it a little tricky because in the world of GI, there's so much overlap between the symptoms of different diseases. For instance, abdominal pain and diarrhea could be Crohn's disease, that could be ulcerative colitis or celiac disease, a bacterial infection, a viral infection, a parasite infection, thyroid disease, cancer of the colon, cancer of the small intestine, and many, many, many more. So we use tests for the diseases that have tests to rule some of these diagnoses out. We also rely on the specific description of your symptoms to help differentiate these diseases from each other and from IBS. Now, one way I do this is by asking about alarm signs. For instance, do your symptoms wake you up from sleep? Do you have blood in your stool? Have you lost weight unintentionally since your symptoms started? Do you have a family history of colon cancer or Crohn's disease? Are you anemic? If you have abdominal pain and diarrhea and answer yes to any of those questions, I'm a lot more likely to do testing before comfortably diagnosing you with IBS. Why? Because the vast majority of people with IBS will answer no to all of those alarm sign questions. Now, before we go any further, I think it's important to discuss what IBS actually is. I think many people have trouble accepting the diagnosis or understanding what it actually is, largely in part to doctors not really explaining it that well or understanding it. And that's not always entirely the doctor's fault because IBS is much more nebulous than diagnoses like stomach ulcers or colon cancer. Most people know what an ulcer is and why it causes pain. Even less well-known diseases like celiac disease can be explained to a patient pretty simply. But what is IBS? Here's how I explain it to my patients. IBS is a disorder of the communication between the nerves of your gut and the nerves of your brain. After your brain, the gut has the second most nerves of any organ system in the body. Now, these nerves help coordinate the complex processes of digestion and they help provide feedback to the brain. For example, if you develop an ulcer in your colon, the nerves in the gut can detect that and they feed back to your brain, telling it that there's some sort of damage and this triggers a pain response. This might trigger you to stop eating or seek medical care, right? But with IBS, there's no physical damage to the colon or the stomach. In IBS, the nerves of the gut themselves are not functioning properly. They've become hypersensitive and triggering a negative response even in the absence of any negative stimuli, like an ulcer. An analogy that I often use is the case of a malfunctioning car. Let's say your check engine light comes on. What do? You bring it to a mechanic and they start checking it, right? They might check the oil, they check your fluid levels, they check a lot of things. I don't really know much about cars, but you get the idea, right? But after checking everything, running all the tests and the diagnostics, they find nothing wrong with the car and they send you on your way. But then lo and behold, the next day, the check engine light comes on again and you bring it right back to the mechanic. And it's the same story. IBS is a problem with the check engine light itself. It's a problem with the sensor. For some reason, the sensor of your car, of your gut, is malfunctioning, and it's sending a signal of damage or, in general, some sort of problem, even if there isn't an identifiable one. So why does this happen? Why is there a problem with the communication between the nerves of the gut and the brain? Why are your gut nerves hypersensitive in the first place? We don't exactly know, but we know many of the triggers for this hypersensitivity. One of them is food. Certain foods are more likely to trigger your gut nerves to feed back to the brain and cause pain or diarrhea or even constipation in some cases. We've learned a bit about certain foods that are more likely to cause this. Dairy and gluten, for example. A big category of trigger foods that we've identified are called high FODMAP foods. FODMAP is an acronym for a bunch of different types of sugars. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So you can see why we abbreviate it. But these aren't sugars in the sense of like desserts or candy or cakes. We're talking about nutritional building block type sugars. Meaning you can find these in many foods that you probably think of as healthy foods, like apples or onions or mushrooms, for example. The key word from the acronym is fermentable, meaning these types of sugars are more likely to ferment when they're in your gut and produce excess gas or liquid. Someone without IBS probably wouldn't take much note of this. But in people with IBS, the nerves of the gut interpret this kind of minor bloating or increase in liquid as much more severe. And that's what feeds back to the brain, making you feel discomfort, bloating, even pain and diarrhea. Now, a second trigger for IBS is your mood. Being stressed, anxious, or depressed can worsen or even cause symptoms of IBS. The thinking is that in this case, the miscommunication between the brain and the gut goes the other way. Your brain is feeling stressed out, anxious, and depressed, and this signal is received by the nerves of the gut, and this is manifested by feeling pain or having diarrhea. Many people might get a minor stomach ache or have some diarrhea in the morning when they have a big job interview or a big exam, right? So in people with IBS, minor or typical stressors can trigger these sorts of responses too. A third trigger is changing your gut microbiome. Now, your gut microbiome is essentially the trillions upon trillions of bacteria that call your colon home. These bacteria help with digestion, but also play a role in other aspects of the body. Now, the balance of good bacteria and bad bacteria in your gut can predispose you to having IBS and to triggering your IBS symptoms. This balance can be impacted by medicines you take, especially antibiotics that could even kill off the good bacteria in your gut. Foods that you eat can be a trigger, diseases that you have, especially GI infections, and this can be tied to your genetics as well. We can use all of these known triggers as a way to manage and control symptoms of IBS. IBS is a chronic disease just like Crohn's disease. This means we can't cure it, but we can manage it with different treatments, including behavioral changes and even medications. For example, we can systematically subtract and re-add FODMAP-containing foods to the diet to see if this impacts symptoms. Cut out dairy for 2 weeks, then add it back and eat it at least once a day for a week. Did you notice a difference in your symptoms? You can do the same thing for gluten and then with the less known FODMAP-containing foods as well. While most people know that highly processed foods might make your gut feel bad, there are many high FODMAP foods that are considered pretty healthy, or at least neutral. Mushrooms, onions, garlic, these are some common examples. I've had a patient who had incapacitating gas and cramps and bloating from their IBS, but when they cut out onions completely, they have hardly any symptoms at all and don't need to worry about it. The biggest issue with the low FODMAP diet is that people don't get enough education about it. They're told to simply avoid all FODMAP-containing foods. And if you look at this list of FODMAP-containing foods, that would be very challenging, and that's why I recommend approaching it systematically and only eliminating a few foods at a time, at most. And when you reintroduce, you have to do it one at a time so that you can know which one actually is impacting your symptoms. Now, with regards to mood, improving your mental health can make huge improvements on your GI issues. Now, this means different things for different people. Potentially getting therapy, starting a medication for depression, quitting a stressful job. All of these things can improve IBS symptoms. Now, unfortunately, many people's symptoms are just discounted as just from stress, and that's a bit too reductive for most people. But improving your stress management and reducing the stress in your life will usually help your IBS. We can also try to target the microbiome in a few ways. Eating foods rich in natural probiotics like yogurt and making sure to eat enough fiber, aka prebiotics, to help nourish the good bacteria in your gut can go a long way. 30 grams of fiber is a good goal for many people. I do not typically recommend taking a pill version of a probiotic simply because there's not really good evidence showing a benefit from doing this. Now, eating foods rich in probiotics will do plenty. There's uncertainty about the number or type of bacteria in a pill or capsule version of a probiotic, and they aren't regulated well enough for us to really know whether the pill versions are actually effective. There's also an antibiotic called rifaximin that helps symptoms of IBS with the diarrhea subtype based on a prior study. This antibiotic is unique in that it does not get absorbed into the blood, meaning it stays in the gut, and the thinking is that this helps with the balance of good and bad bacteria. Many antibiotics can hurt this balance in the microbiome, so avoiding unnecessary antibiotics is also very important. But rifaximin has been shown in some cases to improve symptoms of IBS diarrhea subtype. Now, what about other medicines? Dicyclamine is an antispasmodic that helps with the pain of IBS. It's often prescribed as needed, which is more appealing than a medicine that you need to take every day. You can simply take it when you're having pain, for instance, a more stressful day than usual, or after eating a trigger food by mistake. The medicine helps relax the smooth muscles that make up the intestines. Spasming of these intestinal muscles can often trigger the pains of IBS. Other as-needed options include laxatives or antidiarrheals. Some might argue that these are just band-aids covering up the root issue, and that's not completely inaccurate, honestly. But sometimes a band-aid is a fine solution if symptoms are rare or not too severe. Sometimes uncovering triggers or making the needed dietary changes are harder than they seem. Another type of medication that's commonly used in IBS is the tricyclic antidepressants. These used to be used as antidepressants, hence the name, before SSRIs came around. But we've shown in studies that they can also help control IBS when taken on a daily basis. Now, You might ask, why is that? Now remember, when we talked about what causes IBS, the thought is that the nerves of the gut are hypersensitive and get triggered by typically benign impulses. TCAs, tricyclic antidepressants, can effectively dull this hypersensitivity and therefore improve the pain and change in bowels with IBS. And this is a more direct way to control your symptoms, sort of getting at the root cause, if you will. Now, there's always downsides. Downsides are that you have to take the medication daily and the fact that it often takes several weeks for positive impact to be noticed. And then finally, these medicines aren't without side effects, including constipation, fatigue, and brain fog. I very, very rarely jump straight to these medications for most people because of all those issues. I usually try the other options I've discussed first. Managing IBS is not like treating other diseases. Not only are there a ton of treatments, there are a ton of types of treatments, and there's a huge spectrum of disease severity. This is where the art of medicine really comes into play, because you have to match the treatment to the patient in front of you. IBS is not one size fits all when it comes to treatment. Unfortunately, many doctors only feel they have enough time for a one size fits all approach, so this nuance often is lost or ignored. Some doctors also like to label anything undiagnosed as IBS, but it actually, as we said, has fairly specific diagnostic criteria, even though there's not a specific test for it. Again, doctors often don't take the time to tease out this distinction, but some do. IBS is also being better understood every year, and newer GI doctors especially are getting better and better at treating it. IBS can be severe and life-altering, and while it can't be completely cured, it can be controlled. Hopefully this has shed some light on a common and misunderstood disease. Please leave any questions that have come up in the comments, and I'll do my best to try to answer them. Thanks for watching, and please consider subscribing. Thanks.